Hello, I'm Dr. David Roberts from Manchester West Veterinary Hospital, and we're going to talk to you today about prescription diets, diets that can help treat diseases, prevent diseases, and sometimes keep them from coming around. And we're going to go over the dog diets, canine diets today, and we're going to start off with some of the simpler foods. When we have a pet or a dog who's eaten something or has a problem with its intestinal tract, we will go to a food that's called ID. What ID is, it stands simply for intestinal diet. What that food does is it's basically a bland type of food. It's a lot like your hamburger and rice, but it has all the nutrition that a pet needs. Sometimes with the intestinal tract, we also go to diets like this one called RD. And RD is a food that does two things. It is certainly a weight loss diet, but we also use it for the fiber content, just like people take fiber for their intestinal issues. So we have twofold type of thing that we can use that food for. Another thing that we see with pets, especially with our canine patients, is we see allergies, skin allergies. And we have many different recommendations for that. This actually is called DD, which stands for Dermatological Diet. It says skin support. What it's made of is potato and venison. So it's made from ingredients that your dog has not been exposed to and what the dog needs nutritionally, but it doesn't have any of the allergens that might be incorporated in their skin condition, because food allergies are number one on the course. We have another food over here that we use, and I use this for my dog, Cruiser, that is a skin and coat formula, but it's made of, we call it FP. It's made from fish and potato. Fish and potato are ingredients that your dog probably has not been exposed to, so what it does is it gives them relief from a hypoallergenic standpoint. As pets start to progress in age, as dogs progress in age, we start to see other problems. And one is we will see problems with joint disease, arthritis. And when we look at this model, this shows a lot of bone spurring and bone scarring, and that's what an arthritic hip looks like on a dog. When we look at this side, it is a nice normal joint. And we see this commonly on a daily basis at our practice, having dogs that have hip dysplasia. What we use for that is we use a product called JD. JD is actually for joint diet, as you might imagine, and it gives them mobility because what it does is it adds in glucosamine and different antioxidants that will help the joint and help the pet move better. The other things that we see with our patients as they get a little bit older are kidney problems. And when we look at kidney problems, there's the go-to diet that's called KD. It says renal health. Renal is kidney. And what this food does is it basically lowers the amount of protein, phosphorus, sodium, all the things that a person or a pet is having that you want to lower when they're having kidney issues. So that is something that we use quite often because it is a common type of thing that we see with our canine patients. The last one is related to stones, bladder stones. When dogs and cats get bladder stones, they're in the bladder, not in the kidney. People talk about kidney stones and passing a kidney stone and it being painful. Dogs and cats don't usually get that, but our canine patients will actually get stones, and they are like little rocks. They are hard, they are non-dissolvable, and they are a problem. When we find that situation, we have to usually do a surgery. We have to surgically remove them, but then we have ways that we can prevent them from coming back, because about 2/3 of those patients will have a recurrence of these stones. So we use foods like this. It's called CD, and it's a urinary tract health formula. It lowers the amount of minerals that make these stones, and by lowering the amount of minerals, those stones won't form. And another one we carry is called urinary SO, and this is our canine formula to try to keep bladder stones from recurring. So when your veterinarian talks to you about diets, and he talks to you about various ways to prevent or trying to treat various conditions, these diets sometimes can be in place of medications or surgeries or other things that the pet may need. So that is where these prescription diets come into play. My name is Dr. David Roberts from Manchester West Veterinary Hospital. Thank you for tuning in.